So my name is Pierre Alexandre Fournier. I'm co-founder and CEO at Hexoskin.
That's great. So why don't you start by introducing a little bit about Hexoskin, what you guys do, what's the mission of your company?
So we started Hexoskin because we wanted to do AI in healthcare. It was more than 15 years ago.
Wow.
And back then we didn't have the data we wanted to work with to build all the data automation and analysis we wanted to build. So we started building sensors. And at some point people told us we were doing wearables. So we were very early in the space.
Yeah.
And these sensors at some point, because we wanted these sensors to be very easy to use for patients, very natural, these sensors became smart clothing. And today Hexoskin is the #1 smart clothing for health monitoring in the world.
Wow, that's incredible. So have you been to a HITLAB summit before, or is this your first one?
This is my first summit.
This is your first summit.
Yes.
Well, congratulations and welcome. Are there any speakers or that you're particularly excited about, or any talks that you want to listen to while you're here?
Well, all the speakers, really. It's an amazing lineup of executives, pharma, healthcare, entrepreneurs, investors. So this is great. I'm really glad to be here.
Yeah, that's great. So what made you decide to come to the summit today and work with HITLAB, and how do you see it as being beneficial for you, your company, and also the other people who attend?
Well, I've known HITLAB for many, many years, and almost 2 years ago we started working with HITLAB to get advice on how to develop our business as we move closer to healthcare providers with our technology, because we've been doing mostly clinical research defense in our aerospace in the past 10 years, and we're finally moving to healthcare, which was our first goal when we started the company.
That's great. So going back to Hexoskin specifically, you mentioned that you guys were working with AI before anyone even really knew about it. So can you talk a little bit about how its popularity has improved digital health overall, and also how that's impacted your company specifically?
It's a good question. I've been in the AI space for 20 years now. There's been a lot of changes. It sounds like it happened in a very short period of time, but when you've been in the space for so long, you've seen the incremental change in the space, which it's been amazing because it's compounded. So now AI looks like magic when you look at it.
Yeah.
So it's great. I think there's a lot of potential in healthcare, but I think healthcare is still at the stage where we're building the data infrastructure that is going to be that is going to enable AI. That's what we've been building at Hexoskin. Actually, we've been building an infrastructure so we can collect data from patients anywhere, so that it can be analyzed and processed, and we can develop new techniques, new digital biomarkers that we call them now, to better understand what's going on with the patient, how to improve therapies, how to improve care, and how to improve access to care.
Yeah, that's so interesting. So do you think that AI is going to be used in the healthcare market specifically as this kind of really refined and really extensive data collection process to help with diagnosis, or do you think it's going to touch other parts of the field in 5, 10, or 20 years?
Oh, it's going to touch everything, really. So from administration to logistics to the actual clinical care, which is what we're focusing at Hexoskin. And it's going to happen very fast in the next 10 years. If you talk to people who've been working in digital health for the past 20 years, I think a lot of them have been very patient. Progress has been slow. But one of the reasons is that we didn't have EHRs and EMR. So we didn't have that foundation of digital health where people could communicate. That's kind of our internet in a way for clinical data. Now it's in place, and it can be used for clinicians, it can be used for companies developing therapies. It's more accessible than ever for patients. So now there's the groundwork is there, the foundation is there, that we can build our digital health applications on top of it, we can build AI on top of it, and we need automation to solve the problems we have today in healthcare.
Yeah,
and I can expand on that.
Yeah, absolutely. No, absolutely. And just going back to Hexoskin as well, do you think this groundwork is also going to impact you guys in the next 5 years or so? And where do you see your company going specifically?
Oh, absolutely.
Yeah.
Because 10 years ago, if we wanted to put a wearable on a patient, collect data, analyze it,
Right.
where would we send the data?
Right.
10 years ago, they would tell us, well, you can send us a fax. But data on a fax machine is not as useful as in a EMR, where it can feed analytics and it can be, the processing of the data can be automated. And so yes, I think it's a game changer. Now that we can connect to EMRs and we can automate all these things, I think it's all the data becomes much more valuable.
Yeah, absolutely. Well, Pierre, thank you so much for speaking with me. This was so interesting. I really appreciate it. And I hope you enjoy the rest of your summit. Thank you.